It is estimated that 40,000 new HIV diagnoses happen every year in the US and 20 million STD infections as well. To put it in perspective, 1 out of 99 Americans will be diagnosed with HIV in their lifetime.
We're taught and programmed not to think about it, and we forget that sexual pleasure is our birthright. It is everyone's job to achieve sexual satisfaction. What we constantly work for is to get people to understand that HIV is 100% preventable. This means that anyone can take charge over their sexual health and eliminate his or her risk of contracting HIV.
STD rates have gone up substantially. The whole public school system is teaching our kids abstinence only, or okay, if you happen to have sex, you have to use a condom or else you're gonna get an STD, you're gonna get HIV, and that's it. That clearly shows that there is an issue and that education is not helping.
The reality is that monogamy, abstinence, and condom use are just unrealistic expectations that lead to new infections.
Condom use has been very complicated, or very ambiguous. Condoms usually comes from the CDC as a recommendation. Focusing only on condoms, and it could be detrimental because condom only covers one area of your body. The other places are not covered, and usually you don't pay attention to that.
There are 3 medications that are incredible. We call them the holy grail of sexual health. The first medication is medications for people with HIV. This medication represses the virus down to 0 chances of spreading. Anyone who's HIV positive within weeks becomes undetectable. And what that means is that the medication virtually blasts and eliminates the virus from a person's system, so that person is physically unable to spread the virus to someone else. Not only they're unable to spread it, but they're also protected from being reinfected again. The second medication that we believe is tremendous is called PEP.
If you can take it within 48 to 72 hours of exposure for 28 days, it will guarantee that you remain HIV negative.
The next medication is called PrEP.
It stands for pre-exposure prophylaxis, which is to prevent infection before it happens.
It blocks the virus from entering a person's system. If you take that pill every day, there's no chance that you'll contract HIV.
It sounds aggressive that you have to take a pill, but more aggressive will be to take more pills to deal with HIV. It also empowers people to be your own guardian of your sex risks. The only factor that affects PrEP is compliance. And it kind of goes 1-to-1. If you miss half of your pills, you're risking 50%. And if you take 100, it's 100%. PrEP is like car insurance. So it's the same thing, it's about risk.
People don't understand that the HIV pills, they work differently these days. They're not toxic. They really make a big difference in people's lives, and they definitely prevent people from infecting others if they're taking their medicines every day, and they can live normal lives.
People think that are toxic, they're poison, and it's completely the opposite. HIV medicines and also almost all the medicines that are supposed to be used in chronic diseases are way safer than aspirin or Tylenol or ibuprofen. The most common STDs are gonorrhea, syphilis, chlamydia. They're all treatable and preventable. Hepatitis, for example. Hepatitis A, B, and C. They all 3 could be preventable by vaccines. The amount of syphilis that we see in our clinic, we see 9 cases in a week. We have never seen one that doesn't respond to a regular treatment.
It's incredible to see the reaction from government and private sectors.
In fact, during several meetings, the CDC has questioned our reporting data because our rates of infection are so much lower than other health centers.
That's a way we gauge our success, and part of the reason why we believe that what we're doing is worth repeating in other markets.
There's 3 magical pills. There are 3 ways of treatment. They're very successful. Something we didn't know back then that we know today. So, why don't we utilize what we have and move forward and enjoy a great sexual life?
It's quite natural to be scared to take control of your sexual health because we're told so often that that's not something we should talk about. But your health is first wealth. It's the only body that you get, and we would love to walk somebody through that journey and take control of their sexual health. It's a lot more fun when you do.
Good to see you again. All right, take care. All right, bye.